On today's World Insight, China's efforts to head off the COVID surge in Shanghai as the World Health Organization warns no country is out of the woods yet. What's the true state of the pandemic? And online retail services in Shanghai under pressure to deliver crucial food supplies to neighborhoods. Measures taken to improve deliveries from a top executive of a popular food delivery service company. We have seen many new high-tech gadgets play a significant role this time. For example, our self-driving delivery vehicles can do things that are not easy for riders to do in many scenarios. Here's our host, Tian Wei.
Hello, welcome to World Insight with me, Tian Wei, in Beijing. We begin with today's program with the COVID wave in China. The Chinese mainland has reported nearly 3,000 local coronavirus cases and more than 26,000 asymptomatic infections. Northeast China's Jilin province has logged over 300 cases, while overall new cases in the province are on the decline. Shanghai, however, has reported more than 2,500 confirmed cases, more than double that of the previous day. The city has also registered more than 25,000 asymptomatic infections. The World Health Organization's Emergency Committee, on the other hand, on COVID-19 has confirmed the virus still remains a major danger for public health and insists that the countries must stay on guard.
The virus continues to evolve. We simply cannot afford to lose sight of this virus. It's really, really important. As the virus goes underground, we need to track it because we don't know what comes back.
Many countries are easing prevention and control measures. The WHO warns the pandemic is far from over. New Omicron subvariants have been detected in many countries. China has also promoting booster shots among the senior population in the country and then also made headway in researching COVID drugs. For more on the latest pandemic surge in China, we are joined in Washington, D.C. Kate Tulenko, CEO of Corvus Health. In Nanjing, Wu Zhiwei, director from the Center for Public Health Research with Medical School of Nanjing University. Last but not least, in Shanghai, Wang Dan, chief economist of Hang Seng Bank. Welcome to all of you. I want to start our program by talking to Ms. Wang, who is now based in Shanghai and also coming from the financial sector. Ms. Wang, everybody has to eat, right? So I want to know, besides what's going on in the financial sector in your city, do you have access to food and vegetables now? Through what ways?
Well, food supply-wise, there is really no shortage anymore. There were a period in the beginning that was towards the end of March. Things were getting quite out of hand because it was extremely difficult back then to secure fresh fruit and fresh vegetables. And then there were at least twice of the government rationing to most of the communities in Shanghai. And now it's not hard to get some of the basic supply of different kinds of food. It is boring, I have to say. The varieties can change very much, but still, nobody is starving.
Okay, so tell me, what did you get today?
Well, I ate 2 carrots, and that's left over from the last week's rationing from the government, and half an onion also from the government, and a piece of steak. Frozen steak is quite delicious.
Okay, your family members doing well? Okay, so far?
Well, I'm in lockdown on my own. It's probably the longest time I'm in isolation.
How many days already for you?
Yeah. This is the 22nd day for myself.
Let me also ask you on your professional front. So how is the financial industry, Shanghai is well known for, holding on while many of you are now being locked down at home?
Well, Shanghai has its resilience in its financial system. So different banks and different financial institutions have their own schedule. We do have some of our colleagues locked up in our office building to guarantee that all the computers and IT would work. And most of the traders and other personnel are working from home. It is getting more difficult though, because when a trader do their work remotely, they can only concentrate on the largest transactions. For some of the small amount of transactions, they have to let go due to the IT difficulties or the difficulties in getting the paperwork done. So the liquidity is pretty tight in the financial market. It is getting more expensive to borrow.
All right. On the other hand, what about the manufacturing inside the city? Shanghai is well known for manufacturing some of the, mobile phones, autonomous cars, and things like that. So how do you see things are going while you are connecting to your colleagues and friends from different industries?
The manufacturing sector has been the priority in the current round of COVID control. So the factories usually would do in a closed loop style. So workers inside would work as normal. The most difficult part now is to get raw materials in and getting their things out because there's a shortage of trucks and truck drivers. And the delay at port is quite significant now. It's usually around 2 weeks. And we're anticipating probably another 2 weeks of lockdown at least, and that can be some significant cost.
I see. Disruption of the supply chain, some media reports suggested about that. How much do you see, and what do you see are some of the measures being taken so far in order to prevent that from further happening?
Well, some of the capacities in shipping are moved to nearby ports, especially the Ningbo Zhoushan port. They can take over some. But the fundamental solution is still depending on how fast the government can resolve the current COVID situation.
Yeah.
For factories, the workers are given extra protection and they could get better, actually, medical care if anything happens within the factory. But I don't think this can fundamentally resolve the situation.
All right. Last question. I understand that Ms. Wang, today or starting from Tuesday, we got about 6 million people out of 24 million in Shanghai be able to walk out of their house. That's at least the official number. Now, how do you see your timetable likely to be? Do you have any further information? Are you going to join them? Hopefully not in the near future.
Well,
hopefully in the near future.
My compound just had a new COVID case yesterday. So according to the rule, there's at least another 2 weeks in lockdown. So my optimistic forecast is I will be released by May 1st.
I hope to see you after that. Really.
Yeah, thank you.
When you travel to Beijing, do let me know. I would love to buy you a cup of coffee and would love to have a great chat with you. Ms. Wang Dan, I miss you, and thank you so much for joining us and bringing us more updated information from a resident in Shanghai. Appreciate it. Now let me go back to our two other guests who are medical experts and scientists. Kate Tulenko joining us in United States and Wu Zhiwei from China. Now you heard Ms. Wang helping us to understand what's actually going on in Shanghai from a resident's perspective. Professor Wu, now the number is still up in Shanghai, double that of yesterday. Things are still very dramatic there. Makeshift hospitals we know are having some difficulties. You try to accommodate all of these people and the close contact. Professor Wu, tell me more about what is your assessment of the latest?
Well, Shanghai's situation is still worsening, and you can see that the new cases and also the asymptomatic cases are still increasing rapidly. So I think you still need a couple weeks to basically to clear all the cases. One of the issues is that a lot of people are concentrated in this facility. That's one of the problem is that once you have a convert case, then basically it's likely that the other people will get infected as well. So I saw the news that in Shanghai, in some communities, people have to walk out of their buildings and walking towards the nucleic acid testing sites. That's one of the issues. I think it raises a lot of concerns that there could be some kind of cross transmission and infections that would basically promote the cases.
I see. Professor Wu, if I could just follow up, with the numbers still high and likely to rise even further, because we know there is always a way how the cases rise and to a certain extent will fall. How do you see what needs to be the measures being taken? Prioritize all these measures. Please help us to understand.
Well, I think it's a very important that we should develop a so-called stepwise or differential treatment method instead of simply sealed off or close down an entire community and the city. That's not the way of dealing with such a
So
large
what are
scale
you
pandemic.
suggesting?
Well, what I'm suggesting is that if you look at the Hong Kong's data, it's actually in front of me. If you look at the people who received the 3 doses of vaccination, basically in those population, people without basic medical conditions, the death rates are very low and the severe cases are also very low. So if you put that into consideration, that basically, for those healthy people who received the full vaccination, they should give a very different treatment instead of, you put them all together. That's one of the problems right now. You basically stretch all the medical care capacity and cause a logistic issue as well.
China, we understand, is still holding on to the dynamic zero policy. Of course, as the municipality, Shanghai needs to implement that. So, Professor Wu, under the current circumstances, what do you think are some of the priorities?
Well, I think the priority, of course, is you have to conduct a very fast screening and finding out who are actually infected, and basically providing medical care and facility to people who are likely to develop severe cases and life-threatening conditions. The other thing is that we need to pay sufficient attention that the medical resources should not be completely trained to focus on the COVID-19 cases, because there are plenty of other people with urgent medical needs. They need care as well.
I see. Dr. Tulenko, let me also talk about elsewhere in the world. WHO has been warning intensely recently about the danger still of Omicron, suggesting the number of deaths could be even higher than earlier because the number of people getting infected is getting much larger than the earlier variant time. So, Dr. Tulenko, do you see people are aware of that? How would the policymakers work out the difference between the exhaustion and also the awareness and measures necessary?
I think, unfortunately, one thing that has changed the dynamic is that many people see that they're no longer vulnerable to COVID if they've had the vaccination, and that causes them to change their behavior. So I think that governments need to really communicate to folks that even if they've been vaccinated, they still need to take measures to protect themselves, their family, and their communities. And, I think probably the worst of the epidemic is past us because fewer people can actually get severe COVID now because they've either been vaccinated or they had COVID in the past, but we're still not over it. And, governments need to look at how they're going to transition to making COVID endemic as opposed to epidemic. And I think one of the most important parts of this is developing a plan and communicating that to the public of how we're going to move to living with COVID and having it be endemic.
Right. And at this point, we know, Dr. Tulenko, that everybody is testing their own road. And every time when it comes to a new variant, the road could be varied. We hope the next variant will be even less, shall I say, terminal of lives than the current one, but we do not know, even though the trend usually goes that way, but we still do not know. So with all of these unpredictabilities, how do you see the efficiency of adjusting and also the, shall I say, the eloquence of adjusting?
Well, adjusting it is going to be a challenge for most countries. And I also think in some ways we need new metrics to measure epidemics and pandemics. The traditional method is looking at the growth of cases and also the case of mortality rate, which is the percent of people with disease who die. But as we move into it being an endemic, we have to look perhaps instead on other issues such as people's mental health or the economic recovery, because we've never in modern times been through a situation like this. So the current metrics really don't help us, and governments are going to have to come up with more creative ways.
Everybody is testing their own road. Now, Dr. Wu, coming back to you, we see a very interesting trend over the past few, how shall I say, variants period during the pandemic. There's usually the beginning of a severity of a certain variant among population in the United States, Canada, mainly in the Western countries. And then we see the ease of that, and then some of the other countries such as New Zealand, Singapore, South Korea would follow the measures taken by these Western countries. However, at times we see the numbers go up, like Omicron this time. The death is becoming even bigger than earlier expected, the number. So people are once again being very cautious, including those from China. So how do you see, this very interesting development once and again that we have seen among different variants at different times during the pandemic? I hope I put myself clear about this question.
Well, if you look at the early days in year 2020 and 21, and basically the cases going up and down with an interval of about 3 to 4 months,
Right.
and that actually coincident with the opening up and strict implementation of public health measures. So that actually in a certain way reflecting how we behave and how we observe the measures in isolating or in social distancing, basically. So that actually says clearly that those measures are effective in controlling the virus transmission. But as now the Omicron, what we saw is that if you look at not only Shanghai, and also if you look further in Shenzhen and other cities, basically we have implemented all the very strict control measures. And the unfortunate is that the controlling measure no longer able to control the virus. If you look at Shanghai and other cities, and basically, all the current very strict control measures are in place, but the virus keeps spreading,
Right.
suggesting that the current measure is not sufficient in controlling the infections. So that's why I'm proposing earlier that we need to look at the new situation,
All right.
develop new ways
Okay.
of dealing with the virus.
All right. Thank you so much. Wu Zhiwei, Kate Tolenko, really appreciate that. Thank you. And this is World Inside. Coming up in the program, online retail services in Shanghai under pressure to deliver crucial food supplies to neighborhoods. Measures taken to improve deliveries from a top executive of a popular food delivery service company. Next. Welcome back. This is World Insight with me, Tian Wei. A spike in Omicron cases in Shanghai, though most of them are asymptomatic cases. A big part of the city has been locked down for a few days, and that's a huge strain on city's logistics as millions of people are staying at home under what some call static management. Troubles with delivery and containment measures have led to neighborhoods trying to cope with scarcer food supply. The pressure to keep deliveries going falls on online platforms, which are scrambling also to boost the logistics. I earlier talked to Xiahua Xia, the Vice President and Chief Scientist of Meituan, one of China's most popular online services. He told me how his team has been mobilizing resources in order to meet the bigger consumer demand in Shanghai. Xiahua Xia, Vice President and Chief Scientist of Meituan. Thank you so much for joining us. I know you have very busy schedule, but tell me more about why is it so difficult for residents in Shanghai to get vegetables and to even buy vegetables online, Mr. Xia.
我觉得有2个方面的原因，一个方面是说
I think there are two reasons. One is that many people are isolated at home because of the pandemic, so the demand for takeaways and vegetables from e-commerce platforms has swelled. Big pressure of logistics and distribution have been put on our e-commerce platforms.
压到了我们的各个 电商的平台上面。
Now, how are you trying to solve the delivery issue?
我们很多的业务在从2个方面来解决这个问题。
There are two ways to tackle the problem. One is a new way to make delivery more efficient, and the second is improving transport capacity through multiple channels. For example, we have launched a community order collection model. Generally speaking, after a user places an order for groceries on the app, we deliver the order within 45 minutes, which is a strict requirement for delivery. The community order collection model requires all users place their orders and then we deliver them together the next day, which makes the delivery much more efficient. This new model now covers more than 7,000 communities in Shanghai with 8 million people, and we have so far delivered about 170,000 meals within a week.
在这个产品短短推出的1周多的时间里边，我们已经送出了17万份的餐品。
I know also you are trying to use a new delivery vehicle. It is called autonomous vehicle. Tell me more about that. You are trying to use that to solve the so-called last mile problem. Mainly, people cannot do that point to point, but face to face. But rather, you use a vehicle trying to solve that problem. How is it going so far?
OK，这个就是我刚才说的，我们用的第2种策略，就是尽量的去补充运力。其实补充运力。
This is the second way that I mentioned earlier, which is to add to the transport capacity. We have deployed about 1,000 delivery riders from cities across China to Shanghai. Meanwhile, we use automated delivery vehicles, 50 of which were urgently deployed from Beijing to Shanghai. The capacity of these vehicles is very large. They can carry about 150 kilograms of goods at a time, and they can travel at a speed of more than 20 kilometers per hour, way more efficient than human riders. The automated delivery vehicle also minimizes human contact. Amid the pandemic, especially in communities with a high proportion of cases, the safety of the riders can be better ensured as we use automated vehicles rather than riders. Goods on the self-driving vehicles are delivered to a vegetable station or government-designated supermarket. We then set the address in the vehicle system and it can automatically drive to the interior of the communities, where the food is then unloaded by volunteers and distributed within the community.
那这辆车就可以自动的行驶到我们的指定的社区内部，然后再由社区里的志愿者把食品蔬菜卸下来，在社区里分发。
Now, the delivery men are extremely important. Of course, during the pandemic time, particularly this particular situation in Shanghai, many of them are also having difficulties going to work and even to be able to provide themselves with sufficient food, as they might be quarantined in certain places that are not necessarily their home. So how are you helping these delivery men and women while they are trying to provide their public service to the customers who are the citizens of Shanghai?
目前前线的很多的骑手的确非常非常的辛苦。
Frontline delivery workers are giving it their all indeed. All our riders and staff have to wear full-body protective clothing, but many of our colleagues from Beijing left the city when temperatures were still quite low, maybe 3 degrees. And now the temperature in Shanghai is so warm. They did not expect the temperature to rise so quickly in such a short period of time, the result of which is that they wear a jacket underneath the protective clothing. And by the end of the day, they are drenched in sweat. Accommodation is also very challenging. Riders live in hotels, and if there's a COVID-19 case, then everyone in the hotel has to be isolated. So now they have prepared a lot of tents and sleeping bags so that if the hotel is not available, they can sleep in tents or in cars. Many of the riders come from other cities, which means they are on business trips. So travel expenses, including accommodation costs, are covered by the company. Their meals are also provided by the company, but the riders often don't have time to eat, and it's also difficult to buy meals. So we have a support team to serve their riders and help them allocate the supplies they need, including their own meals, disinfected alcohol, and other materials.
调拨这种抗疫所需要的物资，包括他们自己的这个1日3餐，然后包括像那个消毒酒精等等一些物资。
I understand. Now it's already a lot of work, which really makes me wonder about the last question, if I can. I know you have a very busy schedule. With the pandemic situation in Shanghai, everybody is very concerned. We all hope things would go smoothly in the near future, but things are unpredictable. So how do you see the role of science and technology really reflected in this case? And how do you see, the roles of policies of using the right technological tools at the right time to serve the final purpose?
是的，我觉得在这一次的疫情当中，我们看到了很多新的科技的产品。
We have seen many new high-tech gadgets play a significant role this time. For example, our self-driving delivery vehicles can do things that are not easy for riders to do in many scenarios, such as helping hospitals to deliver samples for nucleic acid testing, since it involves high risks of viral transmission. Using automated delivery vehicles, we just need to disinfect the vehicle and it's more safe and efficient. We also saw a lot of other new tech applications. For example, we can now use accurate big data to trace the origin of the virus. We also saw robots being used to do disinfection. The only thing we regret is that we were only able to play a small part in the fight against the COVID-19 outbreak in Shanghai. We still do not have enough automated delivery vehicles now, and we look forward to new technology that can be more useful in emergency situations.
未来我们能够有更多更好的这样的科技产品，能够在这种在紧急的情况下产生更大的作用。
Every effort counts. Thank you so much, Xia, for you, your team, and your colleagues at Meituan for contributing the part that you can at this moment. Really appreciate it. That's all the time we have for today. If you'd like to know more, search World Insight. Check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei. On behalf of my team, thanks for being with us. Bye for now.